Hello, and welcome to UF Radiology. My name is Priya Sharma, and I'm the Associate Program Director responsible for resident recruitment. Today, I'll be taking you on a tour through our department. So first, we're going to talk about our Radiology Residency program. We're going to talk about your experience here at Shands and at the VA. We're also going to talk about the department IT infrastructure. We'll talk about the department culture. And then we'll go on and talk about the good life here in Gainesville, Florida. And I'll talk to you about where our radiology residents have gone from here. Our radiology group is divided into 10 separate divisions. These include the group of body radiology, thoracic imaging, mammography, musculoskeletal imaging, vascular and interventional imaging, neuroradiology, nuclear medicine, pediatric imaging, VA radiology, as well as a department of physics. UF is really unique in that we have our own department of physics. So you'll be getting taught by great physicists, and you'll be having the opportunity to work with PhDs and do awesome research projects. Now let's talk about who's in charge.
Dr. Evelyn Anthony, who's our Chair of Radiology, Dr. Cooper Dean, who's our main program director. I'm Dr. Priya Sharma. I'm the Associate Program Director in charge of resident recruitment. And finally, we have Dr. Pratik Patel, who's in charge of resident milestones.
Now let's talk about who's really in charge. So we have Bree
and Tara.
These are our program coordinators. They will take care of you all throughout residency. They will help you remember when your paperwork is due, when your medical licenses are due, and they will be carrying you through the way.
Now I'd like to introduce you to our chiefs. We have Chief Residents, Dr. Patrick McAlpin and Nidhi Patel, as well as two research chiefs, Dr. Alan Mao and Dr. Joseph Zhao.
So what is training here at UF like? Well, first of all, we have a lot of residents. We have about 45, and each year that ranges from about 10 to 13 per year. Your radiology fellowships include abdominal imaging, cardiothoracic imaging, MSK, neuro, VIR, and women's imaging. So in 2018, we were lucky enough to be selected as one of the semifinalists, 22 out of 150, to be recognized by Aunt Minnie. In regards to our mission, we like to provide outstanding patient care, superior resident education, and create distinctive scholarly activity. Here at the University of Florida Department of Radiology, you are central to patient care. You are going to be playing a role in a multidisciplinary team, and this is very important as patient management, care, and treatment are a large portion of your ABR core examination. In regards to patient care, we do a lot of things hands-on. We have a lot of hands-on workshops when you first get started so that you feel comfortable doing procedures. The picture you see here is of one of our residents biopsying a chicken. So in the beginning of the year, you'll be having an ultrasound biopsy workshop where you get to practice biopsying through a chicken and on other items. You also get a hands-on fluoroscopy workshop, so you get to learn how to use a fluoroscopic camera before you go in and work on patients. So we prepare you really well in the beginning of your training to get started with us. So let's talk about the cases that you may get to see and the cases and the volume that we perform at our institution. So at UF Shands, we perform over 500,000 cases a year. Over at the VA, they perform greater than 250,000 cases a year. So this means that each year, we're performing close to 1 million cases. How does this break down for you as a radiology resident? Well, I'd like you to take a look at this graph. The ACA-GME minimums are identified in the second row. In the third row, you can see what a fourth year, by the time they graduate, how many average cases they see. So you can see you'll get a great body MRI experience because you see about 12 times what you need to see in order to graduate. And you can see the same is true in regards to ultrasound imaging and MSK imaging. You'll be very well prepared for leaving our program to go to either a fellowship or private practice. In regards to how UF is broken down, we have 6 different institutes. We have the McKnight Brain Institute for those of you who are interested in doing research in the neurosciences or neurovascular. We have the Shands Children's Hospital. We have the Genetic and Cancer Institute. We have the OSME, also known as the Orthopedic and Sports Medicine Institute. And we also have the Shands Cancer Hospital. And of course, the most important thing to remember is that we are a level 1 trauma center. We see a large number of trauma cases here at UF, and we are a referral center for a span of 3 hours. We also have a number of off-site facilities. We have the Cardiovascular and Neurovascular Hospital, which is actually located across the street. We have the UF Health Women's Center, which is Spring Hill. This is where our mammography is done. We have the Multi-Specialty Hospital. We also have 2 separate lone standing ERs in Spring Hill and Kannapaha. So you can see our campus is quite expansive. We also are abutted against the University of Florida itself, which gives you a great opportunity to do research and get involved with things on campus. In regards to your rotation, the majority of them will be here at Shands Hospital, and you'll have 11 rotations at the VA across the street. Your outpatient imaging will be done at Medical Plaza, Spring Hill, and the Orthopedics and Sports Medicine Institute. In regards to our IT infrastructure, we have an electronic medical record system, which is Epic. We have a voice recognition dictation system, which is PowerScribe. Our RIS is Radiant. Our PACS archiving system is Visage, and our report archive is Empower. So Visage is a great system. It is user-friendly, it is streamlined. We have it integrated with our PowerScribe and our Epic. Our images are available remotely, so you'll be able to look at them from home or on your smartphone. So if you're interested in looking at cases that were done overnight, you can take a look at night on your iPad or your smartphone. This is also great in regards to research. So if you're doing research, you'll be able to do it from home. And real time, we have multiplanar and 3D processing, so you can process your images yourself. One unique thing we have in our program is the Empower system. Empower allows you to search through all of the cases that have been done at UF. So for example, if you want to take a look at all of the 5-year-old males with appendicitis, you can type that into the search box and say, I am looking for all CTs performed on 5-year-old males. And then it will give you the archive of the last since 2010. We'll give you an archive of all of the cases from 2010 that we have of a 5-year-old male with appendicitis on CT. Now this is great for collecting cases. Let's say you want to make teaching files or you're trying to put together a case report or case series, and it really streamlines your research when you're doing retrospective analysis. We are dedicated to resident education here at UF. It is one of our greatest missions and greatest strengths of our program. We have an introduction to radiology curriculum. We also take you through a comprehensive didactic conference curriculum, which is done through a 2-year cycle. So you'll have the opportunity to see those topics twice during your residency. But don't think you're going to see the same lecture. Your faculty is very sneaky, and we are always changing up our lectures because there are always amazing cases here at UF. We also have case-based conferences, which are led both by faculty and residents. One unique thing that we have at our program is that we are fortunate enough to have an entire physics department. We have a medical physics program which is overseen by PhD physicists, and they are here to help you come up with research projects, prepare for boards, and in general are a very friendly group. Your rotations are done at the workstation. We have face-to-face readouts, case reviews, and we have topic sessions each day in each room. Our resident education is also complemented by visiting professors, the AIRP program, and for those of you who don't know what that is we have a program in which you are allowed to travel. Well, this is when COVID is over. You're allowed to travel over to Maryland at the Armed Forces Institute of Pathology, and you get great lectures from world-famous radiologists who combine your pathophysiology and things that are seen in pathology with what we see in imaging. And it's just great for melding everything that you need to know for your boards. Our faculty also include former oral board examiners, so we know how tests are done. We also have video conferencing when you're off-site, and we have extensive electronic resources including StatDX, Clinical Key, and ebooks. So now I'd like to tell you about something that is very unique to UF Radiology. We here at UF Radiology are dedicated to the education of radiology residents and trainees here in the U.S. and all over the world. The WIDI program, which is also known as Wisdom in Diagnostic Imaging, is comprised of 3 different elements. The most exciting element, I would say, for you radiology residents is the testing element. We have a simulation program. This simulation program consists of you taking 65 cases over an 8-hour period. These are diagnostic, full DICOM set images of critical care cases in order to prepare you and see if you're ready for call. This has been utilized by 46 radiology residency programs all over the country. The next thing I'd like to tell you about is WIDI Learn. So let's say you took all those cases, we found out that you had some areas of knowledge gaps. Well, we're not going to leave you hanging. Well, first of all, we have remediation videos, which you can see and watch an expert take that case and tell you exactly what you needed to say and what you needed to see on that exam. WIDI Learn consists of a number of modules broken down into the different divisions of radiology. These modules, for example, include the plain film module. In the plain film module, you learn how to accurately read a chest film. This also includes test cases so that you learn how to generate expert-level report. Finally, we have WIDI Teach. WIDI Teach is our RadTree program. The RadTree program is really cool because it allows us as your faculty to see how you're doing during the lecture. So what we do is we'll start off with a slide, we'll teach you a little bit, and then we may give you a question. Depending on how you do in that question, we'll progress to a different set of slides. If you don't do so well, we may progress to a different set of slides. So it's kind of like a choose your own adventure, depending on how the class does. And that's why we call it RadTree. Finally, this has been exhibited all over. We've shown our program to the AUR, ACER, RSNA, and ACR, and it's been very well received. Other things that are very unique to our program here at the University of Florida is that we do cover your ABR fees. We have a strong vascular and interventional radiology program, and we offer the ESIR pathway. We also have an interdisciplinary cardiac imaging program where you have the ability to work with cardiologists. We also have a number of advanced imaging modalities, including MP, MRI, dual energy CT, virtual colonography, perfusion MRI and CT, ultrasound, and MRI elastography. And finally, you also have the option to do pain intervention training over at the VA. We have a number of multidisciplinary conferences here at UF, and we encourage our residents to present. Some of them, which we have included here on the list, include cardiac, body imaging, chest imaging, musculoskeletal imaging, neuro, women's imaging, as well as peds imaging. We do quite a few, and our residents always have an opportunity to present and get involved. In terms of scholarly activity, we do a lot. So how is our scholarly activity broken down? Well, let me tell you a little bit about the technology that we have here. We have 13 CT scanners, including a 320 slice CT, dual energy CT, as well as perfusion CT. We have 10 MRIs. These are broken by 1.5 and 3 Tesla, as well as functional and cardiac MRIs. We're also happy to say that we have an intraoperative MRI used in our Neurovascular Institute. In pediatrics, we do a lot of research on dose reduction, abiding by the ALARA principle. So for those of you who don't know what that is, that's as low as reasonably achievable. Your peds radiologists are always trying to reduce radiation. We also do research in dosimetry. In our vascular and interventional group, we have a lot of research being done in Y90 embolization in regards to liver cancers. Our chest group does a lot of research in interstitial lung diseases. In neuro, we have functional MRI, so quite a bit of research is done with our Neurovascular McKnight Brain Institute, and we also do ENT research. In our body group, we also do a significant amount of research. Most of it's done in our prostate MRIs as well as our inflammatory bowel disease. Breast is our first division, which is doing research with AI, working with our Cure Metrics group. Your scholarly activity also includes a research week. At the end of the year, we like to showcase all the great work that we're doing here at UF between our faculty members and our radiology residents. So we conclude our year with the Research Week, where we get to present all of our research. We also have journal clubs, and we support resident travel. One of our greatest missions, and that I'm most proud of, is our mission to give back. Here at UF, we do a lot of outreach. One of our local outreach programs includes the Ultrasound Mobile Outreach Clinic. This is staffed by radiology residents, techs, and attendings that volunteer their time. We work in conjunction with our Equal Opportunity Clinic for those patients who would be otherwise unable to get any imaging done. We also believe in international outreach and giving back to those countries who are less fortunate than us. Here at UF, we have a chapter of RadAid International. We were first approached by RadAid International for help with establishing a radiology residency program in Guyana in regards to how to set up a radiology residency, how to make a curriculum. So I'm proud to say that we did that for them. I watched about 200 hours of radiology residency videos and archived them by subspecialty in advanced and basic, and we sent that all over to Guyana. And let me tell you, they've been so excited by the education we've sent them, and they are very thankful. Stemming from that, we actually hold monthly conferences with them where we do case conference, and they show us cool cases that they have in Guyana, and my residents show them cool cases that we have. And this is really a resident-run program, and I'm very, very proud of our residents. And I hope that you, if you come here, get a chance to get involved. Another unique thing about our program is our UF Women in Radiology. So this is a forum for issues that are unique to women in radiology. A cool thing about our program is that you have 16 core faculty members that are female. And you have a number of female program directors. We have monthly meetings where we have discussion, we have food, we have a lot of fun. We've also had guest lecturers from all over the country. Our program definitely supports and accommodates all mothers. So one of the unique things about our program is that we actually support our residents in their ability to present at conferences. So let's say you did a project. You put together a poster, you may have put together a talk, and it gets accepted. The Radiology Residency program will pay for your trip to attend that conference. We want to encourage you guys to build the best portfolios that you can for your education, and we really believe in scholarly activity. In regards to scholarly activity, our residents have presented everywhere. So our resident presentations have been done at RSNA, ACR, ARRS, Society of Skeletal Radiology, AUR, ASNR, Society of Abdominal Radiology, Society of Pediatric Radiology, and Interventional. One more element that I would like to highlight of our program is our journal club. So we have a monthly journal club. Each month it's going to be a different division. So for example, last month it was body, and our residents actually lead this. Our residents, we have about 3, pick out a paper that was very controversial or interesting, and then they present it to the group over dinner. Faculty from each section are invited, and they also discuss and critique the papers. And the best part of it is you get a free dinner downtown. Here at UF, we really believe in communicating with our residents. We have monthly resident-only meetings. You have an education committee, which meets monthly, as well as faculty meetings that happen every month. We have a mentorship program, so when you first join, you'll be assigned a faculty mentor. You're going to meet with us twice a year. Sometimes they meet with my residents even more so. We're going to assess your progress within the residency program. We discuss you guys every 6 months, and we're also always here for any sort of advice, be it career advice, home life advice, whatever it may be, your faculty is here for you. In regards to your residency training, your training has been restructured in order to accommodate the core curriculum. So in your 4th year, we treat that as kind of your mini fellowship year, and you have a number of elective choices that you can make. In your 2nd year spring or fall of your 3rd year, you'll be attending the AIRP. And in regards to night float, I want to let you know that you have no nights when you're an R1. And there is minimal to no call leading up to your core examination. The best part, I think, about UF is our department culture. We are friendly. It's really a lot of fun. You have caring faculty that invest themselves in your development. And I just want to tell you guys a quick story about this picture. So the man in the center of this picture is Dr. LaRue. He always dresses in a scrub top and khaki pants. So when it was his birthday, we decided to call it Dr. LaRue Day, and everyone dressed like Dr. LaRue. Here, I just want to show you a couple pictures, and these are pictures of our Radiology Residency graduation. We love giving awards. It's like our favorite thing to do. So, you're bound to get a plaque by the time you graduate. Let's talk a little bit about Gainesville. So, Gainesville is definitely a college town. We have a population of 150,000 people, and 50,000 of them are going to be our students. And of course, we're the home of the Gators, as well as the home of Gatorade. So if you're a Gatorade drinker, it was born here. In terms of things to do around town, there's plenty to do. We have a number of restaurants and bars ranging from all sorts of food. We've got sushi, we've got Thai, you name it, it's downtown. We have an arts and spring festival every year, and this is one of the largest in Florida. We have a number of artists that will come and flock into Gainesville. In the lower left-hand corner, this is the Bo Diddley Plaza, and that's also downtown. Every Friday night at 8 o'clock, they have live music. And finally, if you are a football fan, we are the home of the Gators, Division I football. Again, we have fantastic restaurants and breweries. We have 3 new breweries in town. So one thing I think that's awesome about our program is that we have a lot of fun, and we have a lot of fun together. In the top right hand, that's from one of our welcome parties. We had a big pool party. The picture in the center is of our softball team. We have a department softball team. We're known as Bad News Barium, and I can't say that we're very good, but we certainly try. And anybody who wants to be on the team can be on the team. All right. There's also a lot of stuff to do that's outdoors here in Gainesville. The springs are a beautiful place to relax and take your families. The springs are 72 degrees all year round and are just one of the hidden treasures of north central Florida. In the top right-hand corner, we have a picture of Lake Warburg. Lake Warburg is like this secret oasis for UF. With your UFIT, you have access to this large, gorgeous lake. There is free canoeing, free paddle boarding, free paddle boating, mountain biking. There's a ropes course there. It is so much fun and open just for those people at UF. In the lower left-hand corner, we have a picture of our sports and recreation gym. And remember, we are a Division I school full of athletes. These machines are amazing. There's also classes that you can take there. So if you're somebody who's into Zumba or aerobics, there are a number of classes with a number of wonderful instructors. And if you're a bike rider, I'd like to tell you a little bit more. One cool thing about Gainesville is that it is one of the most bike-friendly cities in the U.S. We have a rails-to-trail system, which is basically old railways that have been paved over for bikers and runners to enjoy. This rails-to-trail system is pretty cool because it starts right outside our hospital, literally steps away, and it goes all the way to the coast. It takes about 20 miles to get to a small town called Hawthorne. So a number of our residents have biked there. It's really cute. There's a bunch of restaurants there. It's a cool day trip. You can bike that and then bike home. But if you're really, really, really in good shape, you could definitely try to make it to St. Augustine. Few rare individuals have done that, but it's pretty cool and a lot of fun. The other great thing about living in a college town is that we have great transportation. Your Gator One ID gives you access to the RTS system. You can look up the RTS schedule live, and there's an app where you can see whether your bus is coming in 5-10 minutes, when will it be, where it needs to be, and you can look up all the maps to get around all of Gainesville. We also have the city bike system in downtown, so let's say you just want to grab a bike for a couple hours, bike around, and put it back. Well, we've got that too, just like those big cities. And of course, we have all of our ride shares. We have Lyft and Uber. And if you need to get around town or you need to go somewhere farther, let's say you want to take a trip to the beach, you can grab a zip car and get out there. Gainesville, again, like I said, is in north central Florida, but it is about 2 hours from every single one of your major cities. We're about 2 hours from Orlando, an hour and a half from St. Augustine, and about 2 hours from Tampa. So if you're interested in getting out to the nightlife or restaurants, or you need more of a city vibe, they're really easily accessible. So in conclusion, UF is a great place to live and a great place to train. Here we have some residents having fun. Somebody got a beautiful picture of the parks in Orlando. We have residents that love kiteboarding, they love the water, and we have a number of residents that love to go fishing. So if you're into fishing, there's a bunch of guys that will take you out on their boats and you can go fishing. So now let's talk about what happens after you have all of this fun and learning with us. Where do our graduates go? So our graduates actually end up at a number of various institutions and a number of various specialties all over the country. We have people that match in large university programs such as Northwestern, Southwestern. We have Texas Children's Hospital, people going into breast at Cornell and Emory. We've had a number of people in chest go to MGH, Stanford for neuro. We have people who choose to do MRI fellowships in Northwestern and Wisconsin. We've also had people go straight to private practice. A lot of our graduates do choose to stay here at UF. If you have any more questions after your Zoom interview day and watching this video, please take the time to contact us. Again, our residency program director is Dr.
Cooper Dean.
I'm Dr. Priya Sharma, in charge of resident recruitment, and our program coordinators are Bree and Kara. Thank you so much for your attention while watching this video. I hope I was able to answer a lot of questions, but if you have more, feel free to email me or any of the people that I mentioned before. We are so excited that you're taking a look at our video, and we are so excited to virtually interview you. Get excited for a fun day of interviews. Come and train with us at UF.